How to cope with Britain's ageing population is one of the trickiest challenges facing the country. And it's not made any easier when different agencies dealing with the issue seem to be at loggerheads. The government today said that by 2018, all health and social care services in England must be joined up. The aim is to stop patients slipping through the cracks that currently exist. But ministers admit it will also save money. Our health and social care correspondent Victoria MacDonald reports.
At first, the only person caring for Simon Ward, who has Parkinson's disease, prostate cancer and memory problems, was his wife, Sujen. Now there is an entire team.
Obviously, we've got the carer that comes in once a day, and that's fine, but, you know, timing has to be just so precise.
Mr. Ward had been admitted to hospital as an emergency several times. By February, his wife was emotionally and physically exhausted.
I had to ring social services, and I had to ring district nurses, as well as the occupational therapy people. It wasn't easy to get hold of them.
So in stepped one team on one number, the people Mr. Ward needs from both the NHS and local authorities, health and social care coordinated. It's part of a pilot run jointly by 3 London councils precisely to stop patients from falling between the cracks. It might sound sensible, but it doesn't happen very often. And today, the government announced that from 2018, all of these services must be integrated across England. It is easy to see why the government's so enthusiastic about the idea of integrated care. If it works, it means that patients like Mr. Ward aren't constantly being readmitted to hospital. And there are also the financial implications, because some studies show that there is the potential to save billions of pounds in a relatively short time. It is already known that cutting emergency readmissions alone can save £132 million a year, while delayed discharges from hospital costs the NHS £370 million. Indeed, the 3 London councils believe their pilot will save £38 million a year, though that hasn't been evaluated.
This is driven, I think, more by bettering the service to the customer and having much better end results for our patients. But as the byproduct is that we save lots of money, that's got to be a good thing.
Yet there are already warnings that these changes won't work if the funding pressures on both the NHS and social services continue. All the more reason, though, the government says, to introduce these reforms.
Well, I think this is precisely why we need to change. If we carry on as separate silos, you will end up with a crisis. The system will collapse, be in no doubt. In order to achieve better care for patients and a sustainable NHS, which I care passionately about, we've got to do things differently.
So there we are then.
And certainly it's so far worked for Mr. and Mrs. Ward. He hasn't been back into hospital since February, and she was able to visit her mother, knowing that her husband would be cared for.